1. The NBCE's primary function in chiropractic education is to A. Accredit chiropractic colleges, B. Administer standardized competency examinations for chiropractic licensure, C. Set tuition standards for chiropractic programs, D. Provide continuing education courses for practitioners. 2. Which adult learning principle best supports NBCE test preparation programs for chiropractic graduates? A. Adults learn best through passive memorization. B. Adults prefer content that connects to real clinical experiences. C. Adults resist applying past knowledge. D. Adults rely solely on instructor-directed learning. 3. The NBCE Part 1 examination focuses primarily on A. Clinical case management and diagnostic imaging, basic sciences such as anatomy, physiology, and pathology. C. Practice management and ethics. D. Public health and jurisprudence. 4. When mentoring chiropractic students for NBCE exams, which communication method most improves performance? A. Frequent formative feedback with individualized study plans. B. One final review session before the exam. C. Only written instructions without dialogue. D. Avoiding critique to maintain confidence. 5. In NBCE exam preparation, which instructional design approach most effectively supports knowledge retention for adult learners? A. Spaced repetition combined with clinical case application. B. Single-session intensive memorization drills. C. Unguided self-study without structured feedback. D. Repetitive reading of static content without assessment. 6. A chiropractic educator aligning curriculum with NBCE standards is applying which educational principle? A. Backward design linking assessment outcomes to instruction. B. Memorization first instruction. C. Randomized topic sequencing. D. Competency isolation without integration. 7. When reviewing NBCE outcomes for curriculum improvement, which step ensures evidence-based decision-making? A. Aligning curricular changes with performance data and identified competency gaps. B. Implementing arbitrary modifications after each test cycle. C. Ignoring trend data to preserve course stability. D. Relying solely on anecdotal student feedback. 8. Which evaluation approach best mirrors the NBCE's mission of verifying clinical competency? A. Summative and performance-based assessment. B. Peer comparison grading. C. Self-assessment reflection only. D. Informal observation. 9. When coaching students for NBCE clinical skills exams, what mentoring approach ensures skill retention? A. Simulation-based practice with immediate corrective feedback. B. Reading case notes only. C. Minimizing repetition to save time. D. Ignoring performance reflection. 10. Which adult learning strategy is most effective in NBCE practical exam preparation? A. Role-playing and case-based problem-solving. B. Passive lecture on test format. C. Memorizing test outlines only. D. Reviewing old tests without practice. 11. The NBCE's Part 3 examination primarily measures A. Basic science knowledge. B. Clinical competency through case-based questions. C. Practice management principles. D. Licensing law comprehension. 12. When developing NBCE-aligned curriculum modules, which design step ensures outcome validity? A. Mapping learning objectives to test blueprint competencies. B. Allowing flexible objectives unrelated to exams. C. Focusing solely on faculty preference. D. Removing formative evaluation. 13. In evaluating NBCE student performance data, which method best supports continuous program improvement? Aggregated trend analysis across cohorts. B. One-time test result interpretation. C. Ignoring data to avoid bias. D. Comparing only top-performing students. 14. Which communication approach ensures transparency when discussing NBCE outcomes with students? A. Presenting data clearly with constructive feedback and improvement goals. B. Sharing results without explanation. C. Discussing only high scores. D. Using technical jargon without interpretation. 15. Which regulatory body oversees the use of NBCE scores in chiropractic licensure? A. Federal Department of Education. B. State chiropractic licensing boards. C. National Institutes of Health. D. World Health Organization. 16. A faculty mentor models effective NBCE preparation by A. Demonstrating test-taking strategies and reflective debriefing. B. Withholding practice feedback. C. Relying solely on reading assignments. D. Ignoring exam format. 17. The NBCE's commitment to validity and fairness in testing demonstrates which evaluation standard? Utility. B. Reliability and equity. C. Randomization. D. Simplification. 18. Which component of adult learning theory aligns with NBCE's case-based exam items? A. Experiential learning through application of knowledge. B. Repetition without reflection. C. Passive content absorption. Abstract memorization. 19. When creating NBCE review workshops, facilitators should A. Integrate collaborative learning and clinical case analysis. B. Focus only on memorizing answers. Skip hands-on activities. Provide minimal engagement. 20. The ethical administration of NBCE exams requires A. Confidentiality, fairness, and standardization of testing conditions. B. Allowing coaching during exams. C. Publishing exam questions after testing. D. Student collaboration during exams. 21. Which feedback approach enhances NBCE clinical reasoning performance? A. Immediate, specific, and evidence-based corrective feedback. B. General praise with no specifics. C. Delayed evaluation after the semester ends. D. Ignoring areas of weakness. 22. Exam blueprints serve primarily to A. Outline content areas and competencies for assessment. B. Provide answers for practice exams. Set national licensing fees. D. Rank chiropractic schools. 23. When guiding adult learners in NBCE review sessions, which motivational factor should be emphasized? A. Relevance to real-world chiropractic practice. B. Fear of failure. C. Competitive ranking. Passive compliance. 24. The use of standardized patients in NBC Part 4 primarily assesses A. Professional communication, examination technique, and diagnostic reasoning. B. Anatomy knowledge only. C. Documentation accuracy only. D. Billing compliance. 25. In designing NBCE-aligned simulation labs, which curriculum element is most critical? A. Replication of authentic patient care scenarios. B. Simplified exercises without context. C. Isolated memorization drills. D. Random question generation. 26. A chiropractic instructor using NBCE data to redesign course objectives demonstrates A. Data-driven curriculum evaluation. B. Compliance-only teaching. C. Ignoring feedback loops. D. Arbitrary grading. 27. Which adult learning principle is violated if instructors rely solely on NBCE multiple-choice practice questions? A. Self-directed learning. B. Experiential engagement. C. Practical application. D. Passive repetition. 28. In mentoring newly licensed chiropractors on NBCE ethics standards, the mentor should emphasize A. Lifelong accountability to professional codes and regulatory expectations. B. Passing exams as the final learning goal. C. Ignoring ethical gray areas. D. Delegating ethical responsibility to administrators. 29. Which evaluation concept ensures consistency in NBCE test scoring? A. Reliability. B. Validity. C. Authenticity. D. Transparency. 30. When interpreting NBCE performance data for accreditation purposes, program directors should A. Use longitudinal analysis to identify curricular strengths and gaps. B. Focus on individual student scores only. C. Avoid data comparison. D. Report only positive outcomes. 31. Which communication technique best supports group NBCE review sessions? A. Socratic questioning and collaborative dialogue. B. One-way lecture delivery. C. Silence during student discussion. D. Instructor-only monologue. 32. The integration of NBCE outcomes into chiropractic curriculum primarily serves to A. Align instruction with competency-based professional standards. B. Increase exam difficulty. C. Standardize institutional branding. D. Simplify accreditation. 33. Effective mentoring for NBCE readiness includes A. Setting individualized goals, continuous feedback, and self-reflection. B. Providing identical plans for all learners. Focusing solely on past exams. D. Avoiding follow-up support. 34. When mentoring chiropractic students who repeatedly struggle with NBCE test performance, the most effective intervention is to A. Conduct a root cause analysis and create individualized improvement plans. B. Recommend they retake the test without review. C. Provide identical study materials to all students. D. Focus only on test-taking speed rather than understanding. 35. Which adult learning factor most influences motivation and persistence in NBCE preparation programs? A. Perceived relevance of the material to future clinical practice. B. Mandatory participation without autonomy. C. High-stakes pressure and external rewards. D. Rote memorization without context.